and I will open it up for questions from the media. Please use the hand raise icon. I will call on you, one question at a time. If you have follow-up questions, please raise your hand again, and I will call on you. I anticipate this will take a little bit of time, but I'm hoping we can do this in an orderly fashion. Again, if you have not muted your microphone, please do so now. And with that, I will hand it over to Dr. Kasiriye.
Good morning, everyone. Thank you for joining us.
Oopsies. Where'd she go? Unmute.
Sorry, I think someone muted all of us. Okay, I'm back. All right. Again, thank you for joining us. I'm Dr. Olivia Kasiriye, Public Health Officer for Sacramento County. So on May 21st, Sacramento County Public Health received a report from a healthcare provider about an individual with suspect case of monkeypox. The individual had recently returned from Europe. Preliminary testing was done at the Sacramento County Public Health Lab, and we received the results on Monday, May 23rd. We are waiting confirmation testing from the Centers for Disease Control. The individual is in isolation, is not hospitalized, and is doing well. Sacramento County is coordinating with CDPH and CDC to identify and evaluate close contacts. There is minimal
recording in progress
to the general public. Monkeypox is a viral disease with similar symptoms to smallpox infections, but clinically less severe. It occurs primarily in Central and West Africa and is rare in the US. Recent cases have been associated with travel to Europe. The incubation period is anywhere between 5 to 21 days, and a person is considered infectious from the onset of symptoms until the skin lesions have crusted and the crusts have fallen off and there's a new layer of skin. Transmission occurs mainly by large respiratory droplets or by direct contact with body fluids, skin lesions, or contaminated clothing or bedding. The good news is that the virus is very readily killed by regular cleaning detergents. Symptoms may last anywhere from 2 to 4 weeks, and prophylaxis with a vaccine can be considered in an outbreak setting. I just want to mention I will not be able to share a lot of detail about the individual. So if there are any questions about that, I may not be able to answer them. And with that, I'll turn it back to Samantha.
We will now open it up for questions from the media. As I asked before, please use the hand raise icon and I will call on you and then you'll be able to ask your question. So anyone who has a question, please raise your hand. Anita, go ahead.
Say there's a vaccine available if there is an outbreak. Could you tell us a little bit more about that vaccine and how available it is?
The vaccine has to be ordered from the CDC, and so we're working with the state and CDC to make that determination. There are 2 types that are available. One is specific for smallpox and another one is a newer one that is specific for monkeypox.
Daniel Hunt, go ahead.
Okay.
Yeah, good morning. I jumped on about a minute or so into the call. Is there any testing, contact tracing rather, taking place right now with this infection?
Yes, we are conducting contact tracing.
Do we know at this point maybe how many close contacts this individual's had since returning from Europe?
We're still determining that because we also have to look at what the definition of a close contact is. So we're still in the process of determining that.
Karma, go ahead.
Thank you. Good morning. Can you put in context for us how transmissible this virus is understood to be at this point? My understanding from the coverage we've heard over the past week and a half or so is that what is concerning to some health officials is that it appears people might be contracting this in ways that were not previously considered to be ways to contract this disease.
As I've mentioned, ways that in which it can be contracted is either through respiratory droplets, so being very close to the person and maybe talking back and forth could be spread that way. Other ways are direct contact with the skin lesions or bodily fluids, or contact with contaminated clothing or bedding.
As far as respiratory goes, could you compare it to something that's top of mind for many people, COVID, Omicron? Is it as transmissible?
No, it is not as transmissible as COVID.
So theoretically, if people were taking the same sort of precautions, for example, masking, distancing, would that be something that would keep them safe from this?
Yes, it would.
Anita Chopria, go ahead.
I just wanted to follow up. Do we know when this person returned from Europe?
We are not able to share that detail.
Okay, and just one quick follow-up. If we need the vaccine, is it readily available? Is it something the CDC can send out right away, or does it need to be manufactured? Is this something we have?
The vaccine would be considered only in an outbreak setting, and we would have to make an evaluation of who meets the criteria for close contact in order to make sure that we give it to people who need to get it.
Lena Howland, go ahead.
Hey there, just a quick question for you. I'm wondering, is there any concern for some of the folks that may have been traveling on that same airplane, if that's their method of transportation, when they were coming back from Europe? And also, are you able to confirm which airport they landed at? Was that Sacramento?
We're not able to confirm any of that detail, and we are in conversation with the CDC and CDPH to make a determination whether any individuals that were on the same flight need to be contacted.
And as a follow-up to that, Dr. Kassirier, is there any message that you have to some of our viewers that might be watching this that may have also just recently returned from a trip to Europe?
I think it's important that if people are exhibiting some of the symptoms, especially if they have a rash that is unusual, that they contact their healthcare provider to have that checked out and make sure that if we need to do further investigation, that we can do that right away.
Lucy Mitri, go ahead.
Hello, Liz A. with KCRA. Dr. Kassirier, so just to kind of put this into perspective, obviously this is happening in the context where we've got this pandemic happening, but it sounds like this is a lot different than COVID, as you said, not as transmissible as COVID. You know, what should people do with this information? I guess hearing this, may be alarming at first to some. What would you like them to know?
Well, there are a couple of things to note. One, that it is a rare disease in the United States, and also that all the cases so far have had mild infections. It's important, though, for people that do fit the history, especially of travel to Europe, and are exhibiting some of the symptoms, especially the rash, that they seek care. Because that's being able to get information out through the media is one way that we can get different individuals within the community to know about what's happening and also to seek care when needed.
Miriam, go ahead.
Hi, good morning. My name is Miriam. I'm with Telemundo. My question is, are there any individuals who may be more prone to this disease or easier to get infected?
We're not aware of any differences. The exposure is dependent on being exposed to the lesions or bodily fluids or being in close contact to the person with the disease.
And another question, would you compare this with how COVID started? Do you think, thinking ahead, could this also become a pandemic? Should people be concerned about this?
It's very different from COVID because of the way that it is transmitted. And so definitely we're putting out this information so that people are aware, but we are yet to see where this is going to go or how many cases we're going to get. But I think it's important for people to be aware that we do have cases in the United States right now.
Okay,
Chris
thank you.
Cooks, go ahead.
Hey, thank you. Are there any symptoms that come before the lesions that people should look out for?
Some people may experience a fever or swelling of the lymph nodes, and they might have a headache or other flu-like symptoms, but a lot of people also may not have any of those and may just see the rash as the first symptom.
And those, if just sort of circling back to something you said before, if the lesions are typically or I guess the fluids from the lesions are typically the things that are more transmissible. So if someone just has a normal cough, they may not be able to just give monkeypox. Like if they have pre-symptoms without the lesions, they may not be able to give monkeypox to someone else because they don't have the lesions yet. Is that correct?
What we know is that when a person starts exhibiting symptoms, they are considered infectious. So it would include situations like that if a person has a cough, because it can be transmitted by respiratory droplets.
Daniel Hunt, go ahead.
Yeah, can you just kind of give a sense of the timeline for CDC to give that confirmation? I know that there were 4 other cases elsewhere that the CDC was doing testing on. Do you have an idea when you'll get that confirmation?
At this time, I do not. I know that we did submit specimens to the CDC for confirmatory testing, but I don't have a timeline as to when we'll get the results.
That was done on Monday, or that was done this morning?
On Monday.
Okay, and I know you can't really divulge any sort of details on the patient or anything, but can you give a sense of whether it's a man or a woman, any sort of age group?
I'm not able to give any of that information.
Okay.
Lizzie, do you have another question, or is your hand still raised from your previous question?
I do have another question.
Go for it.
Thank you. So next question, just summer's coming up, people might be making travel plans or have travel plans. So should they factor this in or be concerned about travel to Europe right now?
I think it's important for people to be aware because there are several countries in Europe that have reported cases. So people do need to be aware of this as they make their travel plans. And also, again, be aware of how it is transmitted. And so be careful in the places that they go to and activities that they engage in.
Karma, do you have another question?
Yes, thank you. So Dr. K, if you can, again, help us contextualize a little bit further about, how concerned should people be about this? Is this potentially just something, if you get it, it's an inconvenience, a mild thing, or are we potentially dealing with something serious should this continue to spread?
So far, the cases that have been reported have been mild. But I think the concern for us in public health is always that there might be some people that may end up with a severe disease. So we want to make sure that we prevent any additional cases.
Lizzie, go ahead.
Just want to confirm, being that this is being handled by Sacramento County, this person is a Sacramento County resident?
That's correct, yes.
Do we have any additional questions from the media? As a reminder, this will be the only availability for Dr. Kassirier today with regards to interviews.
Dr. Kassirier, oh, if you can still hear me, we had one more question regarding actually something unrelated to monkeypox. This is about COVID-19 booster shots for kids 5 years old and up. Do you have any idea of when those will be available in Sacramento County?
They are available. We should have information out to the pharmacies and other places that are providing the vaccine pretty soon, but it's available right now.
And any idea of if we might have any walk-in clinics providing those for Sacramento County?
We can send that information and Samantha can forward it to the media.
Okay, thank you.
Chris, go ahead.
Yeah, just a quick clarifying question. So the person so you guys were alerted of the case on the 21st. Was that when the person landed and came back home, or were they already home before the 21st? Is that anything you can give us information on?
21st is the date that the healthcare provider reported it to us.
So they may have already been back in Sacramento prior to that?
Yes.
Okay, thank you. Do you know when they had already arrived back in Sacramento?
I'm not able to provide that.
Okay, thank you.
Miriam, go ahead.
Yes, I had one more question. How did you guys identify it was monkeypox? Like, what symptoms did he have? If you guys can mention that, or how can people be alert of this? What are some symptoms that they can kind of identify?
The rash is a characteristic, and if I think if you go to the CDC website, you can see the pictures of the rash. It's usually raised lesions that are flat at the top, and then they can go through different phases where they become vesicular and then also produce pustules, and there can be secondary infection as well. But I think when you see the raised lesions with being flat at the top, that's one indication. At our public health lab, we also do a PCR test, and that allows us to know if the virus belongs to the orthopox group. And then we send that for confirmation to the CDC that is able to determine whether it's monkeypox or not.
Okay, thank you.
Irma, do you have another question?
Yes. Are you able to share if the person, you say healthcare provider, did they go to their regular doctor? Did they go into an urgent care? Was it a hospital?
All I can say is that they communicated with the healthcare provider, who then reported it to us.
Okay, last call for questions. Does anyone else have a question for Dr. Kassirier? Lizzie, go ahead.
Thank you. One last question here. Just any idea what has sparked this most recent outbreak, not specifically for this one person, but just in general with it spreading all of a sudden?
I think that's still something that the CDC is working on. I know that at least for the United States, the cases that have been reported have been related to travel to Europe.
Chris and Karma, you still have your hands up. Do you both still have questions?
Oh, sorry. I thought I hit lower hand.
Sorry, no.
Okay. Well, it looks like we don't have any more questions. So with that, we will conclude this press briefing. A recording of this will be sent to you all sometime this afternoon. Thank you for joining us.
Thank you.